I really do appreciate all the help that we've had to do this, and I think it's going to be a wonderful day. And I'm so happy that everybody is here to join us for qualitative research at DCU. I wish we could actually be doing this in person, which we've done for many, many years. But because of COVID, obviously, we haven't done it for the last 2 years in person, and we decided that we would try to do it at least virtually. And we have wonderful technical help, so we're able to actually hopefully do this in a wonderful way. Speaking of which, in terms of technical things, we have also set up a hashtag for this, just to continue to spread the technical connections. And the hashtag that we've set up, can I share my screen?
Yeah, you should be able to.
Okay, I set up a little hashtag here. So the hashtag DCU qualitative research, as you can see here on this screen. And it's just tweet, feel free to do whatever you would like in terms of this. And I hope that you will be able to communicate with each other during this. We're going to have each of the speakers will be speaking. That's actually, I should point out that that's the nursing building on the left of that picture. And that is DCU, where you would have been had we actually been here in person. And we have beautiful weather for the last few days, so it would have been perfect to have everybody here. But next year, fingers crossed. So in between time now, I want to just briefly introduce things. As you've seen the program that we've set up, what we have set up is 3 sessions for today, and each session has 3 speakers. The first speaker is actually from Australia, and because of time differences, that's why she's the first speaker, not also because she is a wonderful person and someone I'll introduce in a few minutes. But we're actually organizing things so that we end up being more local to Dublin as we move through the day. We have a few breaks built in as well, and we also have built in time to answer questions. So we're very hoping that this day will actually have an interactive feature. Normally what we try to do with our qualitative research events at DCU is to have them very interactive. And so we're hoping that the technology will allow you as an audience and us as panelists and speakers to interact with each other as much as possible. The additional thing that I wanted to say as an opening remark was I wanted to point out that our head of school, Professor Mary Rose Sweeney, was unfortunately not able to be with us here today. She does send her very best wishes, and she is a great supporter, as are many of my colleagues in the School of Nursing, Psychotherapy, and Community Health for qualitative research, which is the reason why these events have existed for so long at DCU. We've actually had qualitative research events for almost 13 years now. And that is a wonderful thing in terms of thinking about qualitative research, that it's indigenous to this island. As you can hear, I'll try to introduce myself at some point slightly more later, but for now, I was going to point out that even though this is the School of Nursing, Psychotherapy, and Community Health, I am in fact a social scientist by training. I trained in sociology and anthropology at the University of Chicago. I'm originally from Canada, so my North American accent is in fact a Canadian accent. even though when I speak to people in Canada now, I've lived so long in Ireland that everyone believes that I sound very Irish, although no one in Ireland believes I sound Irish. So, in terms of this, I was very fortunate to have been trained at one of the historical places that qualitative research developed. And I was very fortunate to have as one of my advisors, Professor Jerry Settles, who extended the original tradition of the Chicago sociology of qualitative research and urban studies. Qualitative research has been something that I have always been interested in and always tried to support. Theoretically, I will talk at the end of the day about some of the work that I do, but methodologically, I've always been someone who actually has been a bit of a magpie, able to do quantitative work when it is identified, but often working on topics that dictate that qualitative research is much more appropriate. And so I've worked extensively as an ethnographer for many, many years here in Ireland. And in fact, now, thanks to COVID, I have spent more time on the island of Ireland than I ever spent in Canada. So I'm now fully and completely Irish as well. My husband likes to say I can wear my hyphen in both directions, Canadian Irish and Irish Canadian. So, and now we spend more and more of it here. So in terms of today's discussion, I actually worked with my colleague, Mary Kelly. Professor Mary Kelly is head of the general nursing program, and as we were working with Don Clark originally to have the traditional qualitative event at DCU, but we worked closely in terms of trying to think about how to develop this. And as many of you have seen, our technical advisor, Justin Dawson, who's been a godsend in terms of thinking about these things too. So Mary is here and helping with things today, but I'm primarily going to be the one introducing most of the speakers because of the fact that many of the people are either colleagues of ours or people that I have worked with over the years, and who, when I kindly asked them, would you be willing to contribute to a qualitative research webinar, they said yes, and I do appreciate that. So, so that's why I will be the person introducing everyone. So. Mary's going to kindly help with timekeeping and pay attention also to questions that are coming in the Q&A box. I've been told that's the key area for you to put all of your questions. So I'll move to introducing our first speaker then, who I am absolutely thrilled to introduce, Professor Virginia Schmied, who is in Australia. Virginia is at Western Sydney University, and she is at the School of Nursing and Midwifery. I met Virginia through some of the work that I did with my EU Mary Curie Fellowship and working with my close colleague at the University of Central Lancashire. And I love the connections that we have between Australia and Ireland. Virginia was supposed to come to Dublin and to be here in person, and we will have her at some point coming to Dublin, because she has a wealth of amazing knowledge and has worked for many years with wonderful people in Australia in qualitative work, and has influenced my own work in many, many ways for many years. So I am absolutely thrilled that she is presenting today on some recent work that she's been doing, which she has called Working with Community to Develop and Deliver an Online Parenting Forum Culturally and Linguistically for culturally and linguistically I'm going to stumble all day. So culturally and linguistically diverse communities. So thank you so much, Virginia, for joining us. And I'll turn it over to you.
Thank you. Good morning, everyone. Good afternoon, good evening, good late in the night for others. Thank you very much, Tanya, for that very generous introduction. And yes, I am really disappointed that we're not there in person. And the tickets from last year are still in credit, in fact, because I'm ever hopeful that we will get out of Fortress Australia at some point. Yeah, so we're back in lockdown at the moment with just a few cases, something like 100 in Sydney at the moment. This is a project that I'd like to talk about, to have a little bit of a focus on the co-design aspect and that sort of participatory work that qualitative researchers do. That's particularly important. I think the skills and style that we have in qualitative research lends itself very much to that in close engagement and working alongside community. I want to just acknowledge my colleagues Kathy Kaplan and Joanne Mannion, particularly from Western, but also importantly our partner organisations, the Baronia Multicultural Centre and the Community Migrant Resource Centre, which are both in Western Sydney and who we work very closely with, and absolutely the 13 mothers who were and still are our co-design team for this project. I want to start by acknowledging the traditional owners on the land on which I am today, on which the university is. So firstly, Western Sydney University acknowledges the people of the Darug, Tharawal, Eora and Wiradjuri nations, and we acknowledge that the teaching, learning and research undertaken across all our campuses continue the teaching, learning and research that has occurred for tens of thousands of years on these lands. I'm actually on Gadigal country, which is in the Eora Nation, and in the maps that I've just popped there at the side, that's kind of the Parramatta River and Sydney Harbour running up kind of to the top of that photo, and you can see down in the next one where the land is split, the Tharawal at the bottom right there, Darug and Wiradjuri over to the side. So our campuses spread quite a lot across Aboriginal land, and there's a beautiful image of the Opera House with an Aboriginal image displayed on the sails. In Australia, we currently have, in our 2016 census, 33% roughly of the population that were born outside of Australia. We still have many of those, or high proportion of those, from England and from New Zealand, but China and India are our highest migrant countries where migrants have arrived from. We're going to suffer very badly from our lack of migrants. Just over 2 years of not having the same level of migration come in will have significant impact on us. We've been told in the latest intergenerational report, and I've just had a pop up on my screen there, I'll get rid of, just under 30% speak another language at home. But in Western Sydney, 50% of the residents were born overseas, and 52% of people speak another language in their home. And in this particular part of the community, 1.5% of the population identifies Aboriginal Torres Strait Islander. I wanted to start by talking about just about co-design and what that is and how we might understand co-design. So firstly, just to say that people, families, sorry, I've just skipped a wee bit there, that, just lost my, sorry, I'm having trouble moving down something on my iPad. I won't worry about it just for the moment. So the approach to participatory design is important, that we actively involve all stakeholders in that process of co-design, and that it is a process. It is something it's not an event. It is something that's aimed at creating better, building better, so better design based on a richer, deeper understanding of our communities and what they need. And families, relationships and people are the building blocks of civil society. And we often fail to acknowledge that and people's capabilities and we don't often, as policymakers and health service providers in particular, hear their perspectives to meaningfully partner with people. So these aspects of co-design are particularly important to do that, to have something that's meaningful for the end user engagement. Co-design is about challenging the imbalance of power held within groups of individuals who make important decisions about others' lives, livelihoods and bodies, and often with little or no involvement of the people who will be most impacted by those decisions. So co-design seeks to change that through building new relationships, capability and capacity for boundless curiosity. And it uses inclusive convening to share knowledge and power. So there's some particular characteristics that also reflect what co-design is not, and it's definitely not a linear process. It's something that moves around and is iterative. It can't be rushed because it takes time to build those really important relationships. It's not a tick box process, and things don't just happen because they've always been that way, but it involves new ideas, new ways of thinking and innovation. And it's not about reproducing inequality by just addressing the power differentials and expertise at the table. It really does have to engage with local knowledge. It's something that's not predetermined, and it's not a silver bullet for many of the challenges that we face in society. Co-design principles are about sharing that power, prioritising relationships. And I think that's really important to talk about, that none of this is possible without the relationships, the social connections and the trust that's built amongst the co-designers, the funders and the organisers of co-design activities. And that the trust between people paves the way for the conversations that we confront, and so that we can challenge that metaphorical elephant in the room. If we can't just buy trust, we have to build it. And we've mentioned the participatory means, and it is about building capability amongst all of those who we engage, are engaged in the process. There needs to be a clear purpose and a vision. It is inclusive. The work we do needs to be respectful of all ideas and expertise and everything that people bring to the table. Participatory, iterative. We test things, we evaluate, change, adopt. So in some respects has aspects of appreciative inquiry in the processes and work that is occurring through co-design. So I wanted to talk about our project, which we called together Sharing Parenting Stories and Love. And that came from the first phase of the project. So the two broad aims were to collectively articulate the aspirations and needs of culturally and linguistically diverse parents. And we often use the acronym COLD, which is quite hard to sort of get out as well as the long term, but it's very most commonly used phrase in New South Wales to capture the groups that we work with. To co-design culturally respectful play group, parenting group resources and activities. So in a sense, we wanted a product to co-design a product at the end of the day with the group. So our phase one was discovering together what works well, what's great about the community that people are living in for the parents and for the children in the Wentworthville and Constitution Hill areas. And we co-designed then the activities with the mothers and really had a focus to emphasise on cultural connections. We implemented then the activities in a playgroup format. So this was a bit complex for all of us to get a head around, because in that phase 3, everybody was playing 2 roles. In particular, the 5 parents and the co-design team moved into phase 3 to enact the activities we had designed, with an additional group of 8 parents joined us. So those groups together then trialed the activities. And so it was this process of being both a participant but also an evaluator of what we had done. And that was complex for all of us to get our heads around. So we evaluated those activities and now are in the process of trialing those in playgroup settings. So in the discovery, the parents that we engaged in community conversations told us very much around that ecological model about what's important for their children, their physical, cognitive, social development, and the things that they do in the yellow there wrapped around their children to enhance, to facilitate child development and learning. And that was all aspects, but for the parents we engaged in, there was quite an emphasis on academic learning as well, but the singing and the dancing and the different reading and writing and literacy and numeracy were all important for the preschool age child. That was supported by their community context, where they went to libraries and the playgroups, and they knew about the local activities and what was available. And some people we met had literally been here 2 months and they were already connected into these types of services. What we didn't do was reach out to people who weren't connected in, because we're in community spaces to gather this. What was more porous, or where there were gaps, was between the green and the orange. Oh, that's unfortunate colours there. Just realised that what was happening there was that the formal service structures, the health service, the early childhood education and care preschool services, the local government services were not as well as connected in to some of the activities that were happening, and parents wanted to know more about that. And the other thing we learned from parents was that it was so important for them to be connected. And this was the message that we took into phase 2, that those 2 quotes are exemplars of the important for parent well-being to be socially connected for their children then, and for their children to be able to live in that liminal space of that they were living in, of not now belonging to the country of origin and not quite belonging to the new country, but wanting to forge those boundaries to feel a much more comfortable space. So moving into the phase 2, our co-design team, as I explained, was the original five mothers and the 4 community group staff we worked with and the researchers from Western. And we held these co-design meetings. We had planned for 3, but we required 6 to design, and the 7th was our initial meeting where we were really connecting, starting to get to know each other, but also trying to get a shared understanding of the concept of the development of the program. And that was challenging for us, and all of us kept coming back to that. And we found here this iterative process happening in the meetings. So, for example, some of this came from the 2nd meeting, which was kind of really the first real co-design meeting. And we had conversations around setting the scene and kind of trying to get to that shared vision. We talked about topics that were important to the parents. So they talked this day a lot about feeding children, the challenges that they have, and in encouraging children to eat healthy food. They shared stories. We all shared stories around feeding children. We also talked about breastfeeding. We talked about connection and showing our love and affection for children. We talked about ways of communicating with each other and set up a WhatsApp group. So that was to occur in between our spaces. We talked about what the facilitation style would be in the face-to-face group. We were designing at this point a face-to-face group. It's important to say. We talked about children's activities, and so each session was going to have a parent-led discussion forum with some childcare available for the children, and then a shared children's activities session. And we always talked about what was next and if we had to do any preparation before we met again 2 weeks later. So that was kind of very iterative process of how we went across developing our program. And we settled on, the parents were quite focused on having a structure and needing to know what topic would be addressed in each of the forums or each activity. We were a little bit focused on designing a set of activities that could be chunked down and delivered in a play group setting as well. But we went with the parents and the structure, but accepting or discussing that there needed to be flexibility and the go with the flow type of arrangement in any group, and needing to meet parents' needs where they were at that time. So they wanted to talk about, parents decided it was important to get to know each other, and that what we like and do in our communities would be a good place to start, and that we could share a community map, and that we could also have an ideas tree where we shared ideas about children and things that we found worked with children and things we liked in our communities. We were going to have food and meal times and share recipes and discuss feeding rituals and patterns and ways of encouraging children to talk. So we developed some activity around that would be occur, and that they decided that would be good in the second week of the program. We looked at cultural understandings and sharing parenting and cultural beliefs, and we used some DVD resources to prompt those discussions that the parents really engaged well with, and how we connect with relatives overseas. So there was lots of conversation around this, and how do we look after ourselves as parents. This was a particular interest, keeping physically and mentally healthy, nutrition, stress, and also what activities our children enjoyed, sharing activities, but also a little bit of a focus on how do we manage children's behaviour and encourage good, positive behaviour. So the parents designed a program around these topic areas, but with a very strong influence around South Asian culture, but that would be adaptable to other groups of diverse cultural backgrounds. So we had a good idea of where we're heading, and then we had to go into lockdown. So COVID hit, and we had to work out what we were going to do. We actually spent 2 online sessions still finalising the program. We were all happy with that, and then we were just waiting for things to open up, and that looked like that was going to take some time, and we had to work out how we were going to maintain these relationships. So we kept meeting online every 2 to 3 weeks in May, hoping things would open up and we could run our face-to-face in June. We kept meeting in June and July, and we got to August and everyone was getting very frustrated. We wanted to run the program, and it was decided at that point, by the parents in particular, we had to have a go at an online forum. So it was pivoted to that, and it was determined that it would be difficult to do the children's activities online, and that we could only really run something for an hour, and the parents wanted to focus on their topics of interest and their needs, and they felt that was important for other parents. And they also felt that it was important to introduce new parents. So we invited an additional 8 parents, and we split into 2 groups, and we ran 2 forums, one on a Monday and one on a Friday, and with a set group of participants in each. And we shared that amongst our 2 groups. Here you can see these were the topics that got mothers, they were really comfortable to share experiences and parenting tips. And they felt that it occurred in a similar way to how it would occur if it was face-to-face, that everyone had an opportunity. There were some challenges, but they really felt that it achieved the goals, and that the activities and questions and prompts actually still worked. This is the example of the community map below, and we filled that out online as we were going, the different places that parents went to, and that was sort of shared. And then this was some of their tips that they had around how they keep children sort of engaged and amused, and we put those on the ideas tree, and this was all shared with parents. We talked about religious festivals and ceremonies, so they shared the ideas and how they maintain those as migrants in a new country and the importance of those for their children. They connected with each other as new people, so with the 8 additional parents, they could see how an online forum was successful and how a face-to-face one might even be even better for meeting and connecting with each other. There were some challenges, so it's not the same, definitely not the same as being face-to-face. We all still value that opportunity and want that to be the way the activities would run. Children need to be together to be, to build social relationships. So the voices, not the faces. You couldn't see everyone. Sometimes people would turn their phone off, the video off because of internet connection, etc. So that was difficult. Sometimes you just have the voice. There was disrupted conversations. We had the inevitable, you're still on mute, lost in the moment. So, conversations, and if somebody had to jump off to do something. Now that happens in a play group as well, where you lose that connection because a child needs attending to, but it just felt to the parents sometimes they had missed something. Managing time was difficult. Our hour was always an hour and a half in the sessions. So we weren't very good at that facilitation part of it. But we did maintain connection, and we did that through having the meetings, through having the WhatsApp group. The 5 co-design parents met with us on another occasion in the week, as well as running the group, to say, how did that go? What did we learn from that? We reflected on it, and we took those learnings into the Friday group. So on a Monday, we ran a group. On the Tuesday, there was a reflective discussion for half an hour or so. The parents were so generous with their time and able to commit to doing this. We provided recaps and checks of the data that we were collecting around this. And we held progress meetings with the partner organisations as well. The most important thing was that everyone had an opportunity to talk in the sessions. It's just that you tended to go round the screen in a circle rather than being that very connected sort of conversation as women have when talking. So we did celebrate our successes of overcoming the access and data use and, technological difficulties that we had. We adapted to an online environment. There is the potential for a mother's or a parents or a fathers or all parent type group to be run online successfully as a synchronous, so people having a conversation online and participating in sharing through these activities and prompts. But we really feel still the face-to-face will be really important. And we tried to maintain the conversational tone as we went, and that people could just jump in and comment as they were going. And we did get together. This is just part of the groups because we came out of lockdown and we, after running it all online, we were able to get together in December last year, and there's a photo of some of the group there. And so just finally, our next phases, we are planning to work with play groups to run the activities. We are hoping that we can offer some brief training to our co-design mothers to then that they would actually run the activity in a play group session with other mothers, and looking at trialling it in new parents groups as well. So, and other environments. And there is the space, as I said, for an online type of forum as well. So we feel that we've successfully, we have built the resources, they have been developed and written up, and there will be a resource manual that people can access once we've finalised that product. So I'm just really pleased to have had that opportunity to share that with you, and happy to take any questions.
Oh, that's wonderful, Virginia. Thank you so much. We actually have, my colleague Liz Hartney asked a question while you were talking. She was asking if this was, if the methods were designed specifically for New South Wales, or could they be used in other states or other countries?
Well, I would say to that, they're absolutely adaptable to any context. I think I think the some of the activities as we discuss them and plan them were not dissimilar from what you might find in a new mothers group in terms of the discussion type of prompts, or in a parent, a play group or a parent group that continues to meet. We just always emphasised how do you juggle that in the context of bringing very strong, beautiful traditions of parenting from your cultural background, and how do we share those and learn from those in a play group with mixed cultural backgrounds? How do we learn to, share that? And I think that already happens in lots of places, but the opportunity to share these, absolutely adaptable.
So are there plans to have those resources available more widely for sharing?
Absolutely, they will be. So we will have these at the university. We have a group called Transforming Early Education and Child Health, and we will locate the resource packages and the guide and everything there. And we will also, obviously with our partners, it will also be on their websites, and we would hope that Playgroup Australia would perhaps house them as well, or at least a link. So absolutely happy to ensure that colleagues internationally have access to the resources and manual.
I also had a technological question. You were talking about using WhatsApp before COVID, and you continue to use it during COVID. Were there research lessons from COVID that would be technological that you want to take with you with other projects in the future?
Yeah, I think, I think many of us probably do use that. It was the mother's recommendation to connect via WhatsApp. It's a private a space, and they shared so many photos of children's birthdays and other events there. So they continued that connection, but we were very privileged really to continue to be absolutely part of that. At the moment, they're lamenting going back into COVID, and they like to post the numbers of cases. And I keep thinking, oh, I don't want to hear about the numbers of cases as they grow, and stay safe messages. My colleague and I said the other day, I said, we absolutely have to jump online next week with them, because we could go face to face. We hadn't organised it, but now we can't. Now we can easily jump back online with the mothers. They're all at home with their children, probably in school holidays. So I think really it was a beautiful adjunct to the project and to the purpose of co-design and keeping people connected and feeling part of a group.
I actually even love the term co-design, and those we have adopted in Ireland the what we call PPI from the UK term, public patient involvement, and this is along the same lines, but I don't like the terms when we use patient as opposed to recognizing a co-design. That's just a comment.
Yeah, and we're adopting PPI here, so we're well behind the UK and Ireland. Well, you're adopting it as well, but well behind that process of true, what we call in health, consumer engagement. True participation. And I think it is always important to think that it does occur on a continuum, and people will be able to contribute at the level at which they want and are able to, as long as that space is safe to do so. At the end of the day, we still prepared the resources and shared them with the parents to comment on. So we did the writing. Because we didn't want to impose on people to do that. So we still led certain aspects of it. So there's kind of still a leader somewhere, but ultimately you would hope that that leadership, particularly as much as we learn from mental health work, comes from the community.
Well, this is perfect. We've ended exactly on time in terms of thinking about these things. Several people are actually thanking you, and I want to thank you so much. This has been a great way to start our day, and thank you so much, Virginia. It's just wonderful, and it will
Thank you.
be
Look,
a
I feel
time
really
when we can
privileged to
have
have done it, actually. It's really lovely to be here, and I'm definitely going to stay online for a couple of presentations now. So I'm really looking forward to that.
Oh,
But
thank you.
have a fabulous day, everyone.